Welcome to my YouTube channel. Today's topic you're going to talk about chronic otitis media. So chronic otitis media, this is the persistent and recurrent infection and inflammation of the middle ear that usually lasts more than 3 weeks. According to the country that you're in on the guidelines that you use, some ENT doctors will advocate it being greater than 2 weeks, some 3 months. So it is often associated by perforation of the tympanic membrane, eardrum, and ongoing discharge, that is otorrhea, which may be continuous or intermittent. So in the diagram, you can see this is we're in the middle ear, and you can see already perforated the tympanic membrane. So the pathophysiology behind chronic otitis media, it's usually as a result of acute otitis media, and this is a continuous cycle of inflammation, ulceration, infection, and formation of granulation. Etiology of chronic otitis media, we have Pseudomonas aeruginosa and we have Staph aureus. These first two are must-knows. In addition to that, we can also have Proteus and we can also have Klebsiella. So the clinical presentation of chronic otitis media, the commonest one is the visual otorrhea, that is draining ear for long, which is often recurrent. And then in addition to that, you may have hearing loss, and this hearing loss is usually conductive hearing loss. So fever is usually absent. However, if the fever is present, it usually points to complication of intracranial or extracranial complications. So vertical may be present if it involves the rumbling. So if you have infection of the lambis, that is lambiditis, you may present with vertigo. In addition to that, if you have false smelling, currently known as an NB, false smelling discharge usually points to cholesteatoma. So what is the investigation? The investigation is usually a clinical diagnosis, and if it is persistent, kindly do an high-resolution CT scan of the temporal bone. Other tests that you may do, because you said it will cause hearing loss, so the patient may just actually come in with presentation of the hearing loss. You may do hearing test, that is pure tone odometry. Is this test subjective or objective? What do you think? This test is subjective. So treatment of chronic otitis media, the principle behind the treatment is number one, you give orthotopical antibiotics, and the antibiotics that will usually recommend are fluoroquinolones. And then in addition to that, you can do oral toilet, that is cleaning of the ear, and you can control granulation tissue. So the role of surgery in chronic otitis media, the aims of surgery, number one is to eradicate the disease, number two is to provide a dry, safe ear and to restore the function of the ear and to manage the complications of chronic otitis. Indications for surgery include chronic perforation, that you do tympanoplasty, cholesteatoma, that you do mastoidectomy, conductive hearing loss, and otorrhea that is more than 6 weeks despite antibiotics use, that is medical phase.